Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, men now embracing plastic surgery. Is this true? We're going to talk about it. And then the top reasons that women are removing their breast implants. And then finally, we got an interesting segment about a plastic surgeon that just got roasted for giving celebrity and unsolicited advice on the internet. It's pretty funny. So I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is new host, second episode, Kalee. What's up?
Hey, I got the hot tea.
Yeah.
We're ready for the storm.
Yes, we are.
I got my new outfits doing Rent the Runway. I'm not giving them a shameless plug, but I guess I am.
That's okay.
So I'm ready. Let's go.
Excellent. In the box, Mackenzie. Brenna's out of town. Hi, Mackenzie.
Yes, Brenna's out of town. She escaped the Dallas cold to go to Chicago, so.
Which is
that
worse.
Sounds like
Yeah,
it's
that's
gonna
terrible.
be
Not
colder.
much better.
Well, we appreciate you filling, Mackenzie. Please jump in there. I'm gonna probably put you on the spot and ask you questions,
All right.
but nothing crazy.
Sounds
Mackenzie
great.
can.
All right.
Mackenzie can. Okay, all right. So I got some pretty good segments for you today. We had some good ones last week. It's gonna be hard to top
Yeah,
those.
I know. I was thinking that.
But these are pretty good. These are good informational ones, and one's kind of like funny at the end, so I think you'll like it. So, all right, so I got a segment, the first one, and it's time for it's a guy power segment. We always do segments for the ladies,
For the
a
ladies.
lot of them, but this one's for the men out there. Is it guy power or boy? How do you?
I don't really know if there is a power.
Can you not say that? I mean, that may actually be taboo these days.
I don't know. I don't.
Okay, well, I don't want to get if
Bro
power.
Bro power.
I like bro power. All right, so we got a bro power segment. But first, I'm gonna ask you guys a question. Mackenzie, you're gonna have to answer this too. And Mackenzie, I don't know if you are married or have a significant other, but just pretend you do.
I just got
Oh,
engaged.
congratulations!
Thank you.
Whoop, whoop.
That's so awesome.
Thank
well,
you so
congrats.
much.
Okay, well, Mackenzie, I'll come to you first.
Okay.
Would you think it was weird if your fiance? Is it weird to hear fiance? Yeah,
It is kind of weird.
It's kind of weird. Okay.
It is. I like it though.
Would it be weird if your fiance was coming to you and said, "Hey, I think I'm going to get some plastic surgery"?
My immediate follow-up question would be, on what and why?
On what and why? But so you definitely asked the question. What about you, Kalee? Is it odd, like if your husband wanted to get plastic surgery, you'd be like,
No, I'd be like, let's go.
cool, yeah.
But I again, question is where and why.
Where and why?
Yeah,
Yeah,
so
I mean
I
that's
still
a
need-
that's
I
a
need those
very
questions
legitimate
answered.
question, I think. So, historically, men didn't get a lot of plastic surgery, and even today, it's still dominated by women. And there's that's a whole nother conversation of why that is, but there has been this really kind of noticeable trend that men are starting to embrace plastic surgery. And this isn't like brand new. I mean, in fact, I think I did a segment similar to this, but different like a year or two ago because there was some news article that came out. But this one popped up again because of actually a Nightline segment, like ABC News Nightline. In fact, I always like to throw up where I got these from if anybody wants to check it. Isn't there a picture, Kenzie? It's Mackenzie, right? Or is it Kenzie? I'm sorry.
Mackenzie.
You got it.
Mackenzie. Okay. So this was actually on Nightline, and it was pretty good. I checked it out. Like it had some good information, but I always like to read these over and then kind of present my own take on these because I'm in the biz, and this is definitely something that I have seen in my practice because when I started 15, 16 years ago, it was almost an oddity when a guy would come into the practice. I'd see like a guy's name. It's like there's a guy here. What do they want? Why are they here? But over the years that has started to change a lot. And in my practice now, it's actually really common to see men. In fact, I probably see on average one every office at least, sometimes more. And the data on this actually supports it as well. I always like to pull data. I'm a research guy. You learn this. I'm always going to be like, what is the research show? So, a couple interesting little tidbits of information. So in the past, I guess it's 13 years. In the past decade, I apologize, not 10 years, 13. The number of men getting plastic surgery procedures increased 50%. So that's a pretty big amount. 50% in a decade is very noticeable. And just in the last year, it was 6%, which means, that'd be 10 years, it'd be 5%. So it's getting more, right?
More.
So the data definitely holds that more men are doing this. And so I always like to ask the question, why, right?
Yeah.
You guys, the first thing you said is, what are you going to do and why? Hey, guess what? We're going to talk about what men are doing and why. And, and there's a lot of reasons, and a lot of it does overlap with why women have plastic surgery. And we've seen like an increase all across the board, men and women. It's just that men are increasing more than women right now. So have you guys heard of the Zoom effect?
Oh, yeah. Ever since COVID.
Yeah.
I mean, it's like...
Yeah. So
turn
that
camera.
has played a part in men in seeking plastic surgery because they see themselves more. This is it holds true for women too, but it's also for men. Another big reason is just the rise of social media, and the fact that now, as we talked about last week, that plastic surgery is really not taboo like it used to be. People talk about it. I mean, it's not crazy to hear people, and it's odd for me because I'm in the business, and so people always, or not always, but people frequently want to talk about plastic surgery with me, but like even amongst friends. I mean, so I'll ask you girls, I mean, do you ever have friends that talk about it? And not necessarily surgery, but just like aesthetics.
Oh, all the time.
Yeah.
I mean, I really do think it is like a self-care thing. And I think, women have always
it's
been
kind
at
of
the
changed.
forefront of self-care. So now men are, I think, starting to see, it's not just, hey, we just want to go out and have surgeries for no reason.
Right.
It does do something. It is really beneficial. So
yeah, and I'm glad you brought that up because there are a lot of studies out there about people who do go get some sort of, and this could be aesthetic procedures or aesthetic surgery, and like how does that affect their life? And there are a lot of like, and this is obviously if everything goes okay.
Yeah.
If things don't go well, then people obviously are not as happy. But for people whose surgeries went relatively well, there's a lot of data to show that there's a lot of improvements in their life in multiple areas, like relationships, both personal, work, self-esteem, self-value. So I think people are starting to notice that. And then two other things that are kind of driving men. One is the Ozempic effect. I mean, people are losing weight now and doing it very, very easily, and that is generating plastic surgery patients. We're losing the liposuction cases, which is fine, but we're gaining like contouring procedures because when people can lose 50, 80 pounds pretty easily with Ozempic, semaglutide, Mounjaro, whatever they are using, then they're going to get loose skin. And it happens to men too. And what's really odd, and I'll talk about this in a little bit when I talk about what people are doing, I actually do a fair number of tummy tucks on men, which historically was not a thing.
Yeah.
And then the last thing, sorry?
I said interesting.
Yeah, it is. It's weird. Like it's interesting to see how things change. And this one is, I think, probably the biggest one, or the one that a lot of people don't think about. There is ageism in the workplace. And, there was a big lawsuit against Google, and it's been like a decade now, but there was this group of men that basically proved that they were not getting promoted because of their age. And so, that's a real thing. And so men sometimes want to look as young as they can just for, the potential work benefits. So, all right, you guys asked, what are your husbands going to do? And I don't think they're going to do any of these things. But
I was going to say, is Jonathan watching?
But it is a good question, right? It's like, what are men doing? And I thought that my practice might be skewed a bit because I am a specialist in breast and body. And so the one thing I do a ton of on men is the gynecomastia or the man boobs. That's super, super common. I do at least...
Interesting.
Huh?
Interesting. I didn't expect that.
Right, and it's one of those things that if you're not familiar with it, you may not even know it exists. But I mean, it is a real thing. The reason you don't see it a lot is because a lot of people who suffer from gynecomastia, you just won't catch them with their shirt off. It's the people that wear the t-shirt, at the pool because they're, self-conscious about the fact that as a man, they look like they have, B cups or bigger.
Yeah.
And so I do tons of these, and that actually is the number one surgery, allegedly based on an article I found from this last year.
So what do you do in that type of
Yeah,
surgery?
so that's a great question. So it can actually involve several things. Like the main thrust of this surgery is to remove the excess fatty tissue that makes them look feminine. And then on top of that, they can also get the more fibrous components underneath the nipple areola, so sometimes I'll remove that. And then lastly, if they have enough volume, they can actually get sagging after you remove that tissue.
Oh.
And so like I just did one of these Monday. Again, I do these all the time. I do at least one a month and probably 2 to 3 a month of these, which is a pretty crazy number. And the one I did Monday, I did the liposuction to debulk it. He did have that kind of firm area behind the nip areola, so make a little incision, go in there and just carve that out so that it doesn't have this hard spot. And then because I removed so much, I had to just tighten up the skin around the areola, and it looks great. He's already come in the office. I saw him yesterday, and he's like, "Yeah, I feel good. I'm, he's a little swollen, which is normal, but super happy." These patients really do appreciate it because I get it. I would be self-conscious about that.
Yeah.
That's not something.
Is it similar to like a breast reduction surgery for a woman or no?
It's similar in concept.
Obviously not the same.
It's similar in concept, but different in technique.
Yeah.
When you're reducing that much for like a woman breast reduction, which is what I did this morning, it's just a lot of different technique. The men version is kind of a scaled down version, if we're being honest. I can do, like the breast reduction I did this morning was pretty big. I took off almost 5 pounds. Like that's a ton.
Yeah, that's a lot.
That's a lot. But it took me, a little over 4 hours. A male reduction, or gynecomastia repair, I like to call them. I can do about 2. It's just smaller operation.
Gynocapacity repair.
Oh, gyno. So it's gyno. So like gynecologist.
Yeah.
Right.
Gyno.
So gyne, like women. Mastia chest. It's like women chest on a men. Gynecomastia.
Gynecomastia.
Yeah.
Can I ask a question?
Say that.
Yeah,
3
please.
times fast.
So what's the recovery process like for that? Will it leave a scar, or like how do you recover?
Really good question. So the recovery for gynecomastia surgery is actually pretty easy. A good kind of just blanket statement is that if you're operating on skin and fat, the recovery is not going to be near as bad as you operate on muscle or bone. And so gynecomastia, or for that matter, breast surgery for women, is usually a very easy recovery, considering. Like it's outpatient, obviously, they come in, they go home. But like the guy I saw yesterday who had surgery Monday, he's like, "Yeah, I feel good." He's like, "Yeah, I'm a little sore, but I'm basically back to normal." And then as far as scarring, if they do need skin taken up, then there is an incision around the areola, almost like if you were doing a small breast lift on a woman. But it hides really well because the areola borders a natural break, and it's a good place to hide scars. So yeah, gynecomastia is super popular. Eyelids and facelift, again, that's probably the second and third most popular that I do on men as well. And so I guess my practice actually does kind of follow what men are doing. Mm-hmm. And then the one I mentioned earlier, tummy tucks. So just really briefly, tummy tucks have not always been popular with men because men tend to hold fat internally. And so a lot of the things you would do in a tummy tuck on a woman, you can't really do on a man because their fat's internal, and it's harder to tighten up the abdominal wall because they have this internal fat, and there's not really anything to liposuction on the outside. And so they just don't work as well for most men. But what's changed? Ozempic. Now, guys can go take Ozempic, and we have lots of people in our practice that are using it, and they can actually lose that weight on the inside, which then does make them a candidate. And so I've been doing more male tummy tucks lately than ever before, and so that's just kind of interesting. It's like, okay, there's medications out there, things change. And the last thing, and I may start, well, one of these I already do, and one I may start. So I actually do lasers every year because it's like really low hanging fruit or very easy thing to do to stay more youthful. I mean, lasers are great for youthfulness of your skin. So I've been doing that for like 4 years. And then the one I haven't done is Botox. And see that? See these? Can you zoom in? Am I looking in the right place? Yeah, I get grief from my office people about the fact that, I run a med spa and I have wrinkles. And so I've thought about doing Botox. I haven't done it.
Hey, yeah. I love Botox.
Yeah, I mean, Botox is another great one. I mean, it's kind of, I think it's a little expensive, honestly, but it works.
You heard it here first.
It is. It's like, okay, I know it doesn't cost, I can't remember who makes Johnson, I think, or Allergan. Oh, Allergan makes Botox. I know it doesn't cost them that much to make that vial. Yeah. Like, it's literally spores of botulism toxin. It cannot cost that much. But the vials, like, we don't make money on Botox in like a med spa or surgery practice. I mean, we do make money, but it's like so small. Yeah. Because there's so many competitors and the vials are so expensive. But anyway, but it is good stuff. So, and this is pretty interesting. So in that article, and I'm gonna I don't know if you can give shout outs to other plastic surgeons because I'm always I'm always wary of other plastic surgeons. I don't trust them. This is a shady, like, it can be shady. So, but I'm going to give a shout out to a Dr. Steinbreck, who I've never heard before. I've never heard his name. But this guy, he operates in New York City and Los Angeles, and he made his whole practice be men. It's 98% men. Wow. Which is wild. And what I thought was kind of interesting is he described the 5 achronotypes of men who get plastic surgery. And I agree with this 100%, although I had never kind of listed it out. So 5 people. So there's the male model actor.
Okay.
That makes total sense.
That tracks.
Yeah, it tracks. The father next door. Okay. I mean, because there's the girls next door that get surgery.
Okay.
Yeah, just like the dad. The chief executive, which would be the person, that may not want ageism to be an issue. A bodybuilder.
Yeah.
That tracks. And then the last one is one that I said as well, those who've had a lot of weight loss. And I do think that, most men will fall into those categories. And so, and then, do I think men's plastic surgery will be as, notable or as much as women? I don't think so. You guys get too much pressure, I don't think men get the pressure that women get about their looks. I mean, obviously, right?
Yeah, no, probably not.
I'm not crazy, right?
No, you're not crazy. I don't feel the pressure, so.
Well, that's good.
Yeah.
And you shouldn't feel the pressure. Yeah. You should not feel the pressure. But
I still do the things, but not because of that.
Right. You do it because you want to do it or whatever, not because you feel like if you don't, then society looks down on it. Yeah, which is great. That's good. That means it's very healthy what you're doing. You're not doing it for the wrong reason. But yeah, I feel bad for women that, they do really get an unfair shake when it comes to that.
I thought it was interesting how that ABC article, I always have to, call out the headlines because they drive me crazy. High earners, that's what they said.
Oh, high earners.
They said like Bradley Cooper and somebody else. Oh, here we go. Andy Cohen. They denied it, but some men, especially high earners. I'm like, what does that mean? Like,
man, I'll tell you.
You don't have to be a high earner to go.
People always think that it's only rich people that get plastic surgery, but it's not. It's like, middle class Americans. Because, I just know that because of where we live and how many people live around us. Like, it's just like normal people that do it.
Yeah. Anyway,
so.
I just had to point that out.
Mackenzie, come to me here. I'm going to recap this segment. So, men getting plastic surgery. I haven't followed suit yet, although I do lasers, and my office staff is trying to talk me into getting Botox. But we were talking today about how men are embracing plastic surgery. I've seen it in my practice. I used to almost never see men in my practice. Now I see at least 1 or 2 or more every office day. And the data says that men are getting a lot more plastic surgery. 50% increase in plastic surgery procedures by men over the past decade. That's a big number, and in the last year it was a 6% increase just in 1 year. So men are getting more plastic surgery. It's still dominated by women. It's somewhere in the realm of 88% women, 12% men, depending on which studies you look at. What are men doing? Well, they're doing some of the things women are doing: Botox, lasers, eyelids, facelifts. Because of Ozempic, men are actually now getting tummy tucks. But the one I do the most, and people don't always know about this one, is I do a ton of gynecomastia, where men have a more feminine chest and they want to get that repaired. And it's one of my favorite surgeries to do because the results are great and men really, really love it. So yes, men are embracing plastic surgery. I haven't gone under the knife myself, but if I end up doing it, you guys will be the first to know.
Gynecomastia.
Gynecomastia.
I did it.
Yay! All right. So along the lines of when I was, looking at articles, there was another article that came out, and I've talked about this sporadically in the past, and I'm going to do this one a little bit different. But obviously, breast augmentation surgery is still insanely popular. It's historically been the #1 surgery in the United States, although in the past few years, it has gotten dethroned by liposuction. Now, there's a little bit more to that story because liposuction is done in addition to a lot of surgeries, so I think that number kind of gets artificially inflated. But tons of breast augmentations are still done. I still like the surgery. However, there has been a huge rise in the number of women taking out the breast implants. Okay, that is a thing now. And so I want to do a segment on the top reasons why women remove their breast implants. And I think this is kind of cool because if you know why women are taking out their implants, it might help you if you were thinking about getting them, right?
I like it. Full circle.
Right, full circle. So yeah. Again, this is something that has been on the rise over the past decade. There was one study that showed in the last 13-year period, there's been a 650% increase in implant removal surgeries, which that's pretty insane increase. There was a 35% increase in 1 year alone, just like year before or last, or maybe 2 years ago. Again, just like with the men segment we just did, I see this in my practice. And when I first started my practice, hardly ever took out implants. Now we take out a lot, and I really do like these surgeries. They're fun to do because they're kind of artistic, and the patients really like them. And recovery is super easy. And knock on wood, I've never had to take one of my implant removal patients ever back to surgery for anything. So yes.
So are
Kalee.
they taking? Thanks. Are they taking them out and then putting like a smaller size back in, or are they just taking them out completely?
Fantastic question. I should have been more clear. So when I say patients are removing implants, that means they're coming out and we're not putting them back in.
Okay.
And that's my bad, and I'm really glad you're here to kind of rein me back in, because the terminology is either implant exchange or implant removal. And so I wasn't clear, but that's great. That's a great question. Yeah. So in this instance that we're talking about today, we're talking about people who are taking them out and just not going with anything. So
is there something? This is a really bad analogy. I'm gonna really hate saying
I like where this is going. When you're like worried about what you're gonna say, I'm getting interested. So
okay,
all right,
so like
I
have hair extensions, and like when I have my hair extensions in, it's allowing my other hair to grow and get healthier, and so are breast implants, when they're in there, allowing your breast tissue, or I don't know the right words, to be healthier? So like when it comes out, you might like them more than they were before?
So what I would say is that if you get really big implants, it can affect your breast tissue. Now that's not something that a lot of people deal with, because I'm talking about really big implants in really small breasts, and the fact that the implant puts pressure on your breast tissue, which will cause atrophy or a decrease in the volume of your breast tissue. Okay. I think that's the closest I can come to answering. Like if you just have like a normal breast implant along with a normal breast, it ain't gonna bother your breast. Ain't. I just said ain't.
That's okay.
I get a strike from like some.
I have no idea what I just
board.
said completely. So.
Okay. But no, I kind of get where you're going. It's like, okay, well, if you take them out, like your breast healthier. I mean, provided that you didn't have like any issues, then not necessarily. Like, I mean, taking them out shouldn't really affect the tissue itself, although it affects the shape, which we'll talk about.
Okay, that's my question. I was like, is there anything negative or positive to this
Yes.
situation?
Yeah, so I'll jump ahead a little bit and just kind of answer that directly since you asked. One of the things you really have to be aware of is that if you remove your implants, you almost 100%, not quite, it's about 95%, I would say, have to do a lift afterwards. And I can show you really easily why that is. Okay, I'm going to do this to the camera. So this is outside of your breast. This is your implant. Okay, Kalee, I'm going to show you. So what happens when you suddenly remove this big volume?
Well, yeah, that was my biggest thing.
Oh, that was
it's
the
like,
question? Okay, I just misunderstood it.
No, it's kind of just like, is there something there that we don't know, Or is it just going back to where things were?
No, it's going to go back to worse than where it was when you started.
Okay.
Yeah,
okay.
It's the same. It's the same example of like if a woman has a pregnancy and say they gain they gain a lot of weight. Say they gain 60 pounds, 80 pounds. I don't know what's a lot. 60. 60 is a lot, right?
I don't know. I never did that.
I'm just throwing numbers out there. So 60 pounds. It's the same effect. The breasts get really big, and then you lose the weight, and what happens? The breasts sag.
Yeah.
And so with the implants, it happens instantly. So that is something you have to consider.
So I have a question then.
Yeah, good.
Why would you do that?
Why would you take them out?
Yeah.
Oh, good.
Because I'm going to be 90 with hair extensions. I make it that way.
Well, I mean, that is that's the whole gist of this segment. So I'm about to lay it on.
Okay,
you.
yay.
You ready? Yeah. I mean, that's a good question, right? It's like, why are women taking out breast implants? And I broke this down, and so I didn't get this from any article. This is just my experience, which is really, really deep because I specialize in breasts and I do these surgeries literally all the time. So I broke it down into what I think are the top reasons. They're pretty accurate. So number one, and this is what I think is the most common reason that women will remove implants, is that their bodies have changed since they got them put in, okay? So what do I mean by that? Well, on average, a woman will gain about 15 pounds per decade, okay? So let's just say that you've had implants for 20 years, okay? What?
I just don't like that. But yeah, no, you're right. I'm just saying personal feelings.
I'm sure with men it's probably as the same or higher. It's not. I don't mean to single out women. Only women gain weight. No, I didn't say that. I mean,
women.
It happens,
go through
right?
some things that
totally
happen.
Absolutely right. Okay, so say you've had your implants for 20 years and you're the average woman that's gained 30 pounds. What's going to happen? Your breast tissue that you have is going to be a lot bigger.
Yeah.
And so not suddenly, over 20 years, you suddenly have, I keep saying suddenly, over 20 years, you now have more breast tissue than you had when you had the implants, and your breasts are much, much larger than they were when you got your implants in, right? Mm-hmm. And so I see this literally all the time where women come in and say, you know what, when I got these implants, I was like a small D, but now, and they won't come out straight up and say like I've gained a bunch of weight, but I mean, that's what happens. That's what happens, right? And so now they just don't need breast implants. They just don't need them. And so they can take out their implants and they have enough volume to fill out their clothes and fill out their bathing suits and be proportional. And they're totally fine. And so that to me is the most common reason is that, and I consider this.
And do they get a lift with it?
Yeah,
okay.
Yeah. Almost,
that makes a huge difference.
Yeah, it makes all the difference because, I mean, you take a breast implant out and most likely you're not going to be happy with the shape unless you lift it. I mean, it just is what it is. I mean, and I probably should mention that when people are getting their implants, say, hey, by the way, if you take these out, you're probably going to need a lift. But I think a lot of people kind of realize that. So the second one is changes in desired body type, right? I mean, there's a lot of people when they're 20 that are like, you know what, I want to have like double Ds. I mean, there are people out there. I mean, I see them in my office all the time.
Yeah.
I mean, it may not be the people in the studio, but I mean, there's people out there that like were like, I'm young, I want to, rock these bathing suits or whatever, and they go and they get big implants, and then what happens? People kind of change what they want for their own bodies.
For sure.
And so suddenly maybe they did gain weight, but you know what? I just got bigger implants than I wanted.
Yeah.
And that also goes into like people getting talked into getting big implants. That happens literally all the time, and I really don't like it. I see patients in my office a lot, either for implant removal or implant swap, where they're like, you know what, I didn't want these big implants, but my surgeon didn't, make it really clear what I was getting, and now I have these huge implants, and I just don't want them anymore. So the one that the number 3 reason, and I really hate this one because it makes me sad, is if they've had so many complications that they're just done with them. That's not as common, obviously, these other two, but it does happen where somebody, I mean, it could be anything, like they had, an infection, or they got scarring, and they had a surgery, and maybe it didn't work, and they have, they end up having multiple surgeries, and they're still just not happy for whatever reason, maybe because they had to have multiple surgeries, or maybe they still just don't like the look. That does happen. I do see those patients from time to time. It does make me sad, and empathize with them, because in reality, anyone should be able to get a good augmentation. I mean, it's more of an artistic surgery than something that's like overly complicated, right?
Yeah.
Meaning, yes, there's ranges of like quality, but like it's not an overly complicated surgery, and people shouldn't get results that cause a lot of problems. The complication rate should be very, very low. And then the last one is one that gained a little bit of steam a few years ago, and I'll have to ask you ladies if you ever heard of this. You guys ever heard of the breast implant illness? Mm-mm. No? Okay. I'm actually surprised to hear that. And I don't mean that in a bad way whatsoever, because this got a lot of social media traction a few years ago. There's this phenomenon called breast implant illness, which really has never been proven to actually be a thing. And there's been a lot of research into it, and everything keeps coming up empty. But the phenomenon is that some women believe that the silicone implants are causing them to have symptoms not in their breast, but globally. Like we call it constitutional symptoms.
Oh, okay. Yeah. Like the foreign object in their body is...
Yes, yeah, right, exactly right. And Danica Patrick, the race car driver, was a big proponent of this. And so like it got a lot of steam on social media, probably, 4 or 5 years ago. Now, of course, a lot of research has been done to see, okay, is there any link to this? And none has been found. I'm going to throw my 2 cents out there, and this is in no way to diminish someone who believes that they have this. Yeah. But a lot of the symptoms that people claim, things like headache, fatigue, and joint pain, are normal symptoms of aging. And so you almost wonder, like, are people having symptoms of just getting older and attributing to something. So, but yeah, I don't see that. I've done 2 of those in my career where someone came in and thought they had breast implant illness. And so that's a pretty low number because I do tons of these. So, but yeah, I really do like these surgeries. As Kalee, you mentioned, which is a really smart point. If you're going to take out your implants, you almost certainly have to have another procedure at the same time, of course, not 2 separate.
Yeah.
But you need to lift the breast because, again, you take out the volume, the breast collapses, and it just won't look right. The good news is, I mean, you can do a lift on these and they can look great. I mean, I just did. So yeah,
How many lifts can you have in your life?
I mean, you can repeat them, although ideally shouldn't. Like I always tell people, you never want to have to do a repeat facelift or repeat tummy tuck or repeat breast lift, because if you get them done, I mean, realistically, the only thing that would push you to have a second one is if you had a lot of weight fluctuations.
Mm-hmm.
Weight fluctuations are not good for body contour. You know, just like pregnancy. It's why I'm in business. I mean, I do surgery on a lot of people, but the bulk of people I see are women who are done having kids. They had the weight fluctuation.
What about people who have done this prior to having children and then later down the road?
Right. Yeah, that's a great point and something I always talk about when I get women in who are younger. Like, say someone comes in, they're 20. I'm like, do you have kids? I mean, I don't ever assume people do or don't. I'm like, do you have kids? And they're like, no, I don't. I'm like, okay, well, just be aware that, if you have this surgery and you have a pregnancy, which is, very possible, that your body's going to change and it might change your result. I mean, it's kind of common sense, but I do like people to be aware of it. So,
interesting.
So,
Can I ask a follow-up question?
dude, bring it. I'm ready for. I'm here for it.
So thinking about like being pregnant and having breast implants, does that affect nursing at all?
Yeah,
or how does that work?
That's a great question. So the data says that there is a very small percentage, or very small percent risk that it could affect your ability to breastfeed. Now, I'm going to say that I think it's really, really small because I think that the data that showed that lumped in when they used to do incisions around the areola, which I would never do that. I just don't like those incisions. It's too close to the nipple for my liking, and there's potential issues with that. I think if you do the standard behind the breast augmentation, that the risk of it affecting your ability to breastfeed is very, very low, probably 1%. So that's a great question. It's one that people do ask. Yeah. I don't think it makes a big difference. The one thing about having implants is if you make your breasts bigger and then you gain a bunch of weight, like it really stretches them out, and you're almost guaranteed to need a lift afterwards because your skin's already stretched out from the implant, and then you get the weight gain, and then they're even more stretched out, but then you lose the weight, and your skin's just like, oh my God,
I can't do this anymore.
I'm done. And so
call in reinforcements.
Yeah, I know, right? Yeah, call in the reinforcements. So yeah, that's just something to be aware of. So. All right, let me recap this real quick, Mackenzie. Today we did a pretty interesting segment on why are women taking out their breast implants. Now, this is a surgery that has gained a ton of popularity over the last 10 years or so. In fact, a 650% increase since 13 years ago of people removing their breast implants. Now, I still like breast augmentation surgery. I think it's a good surgery, but there are some definite reasons that women take them out. Number one, I see in my practice, is that their bodies have changed. It's very common for people to gain weight as they get older, and if you gain weight, your breasts will get larger, and suddenly that mid or large D that you got 15 years ago is now a triple D that's kind of out of control. And at that point, you probably don't even need your implants anymore. So that's number one for me. Also, people's desire for what their body type is has changed. That could be personal or just trends in the kind of national trend from like the shift from the Kardashian body to the ballet body. Also, if people have had a lot of complications, sometimes they just get kind of fed up with the whole implants. I hate when that happens because these surgeries should not be one where people are having a lot of complications. And then the last one is the breast implant illness. We don't hear about that as much. I've done a couple surgeries on people who thought they've had breast implant illness, remove their implants. It's not a really popular reason that people do it, but it is out there. And one thing to remember, if you have your implants removed, you're almost certainly going to need a breast lift because when you have this implant and you take it out, what's your breast going to do? It's going to kind of sag down, and so you'll probably need a lift to get the shape together. But these surgeries are great. I do lots of these. People do well. One of my favorites. So, okay, last one. So this one's kind of a fun one. Well, I say it's fun. It's just more kind of like silly. I don't know. You guys be the judge. All right. So we are going to talk about something that I thought was kind of humorous, but also sad. I mean, I don't know. You guys will get it. But there is some good advice in here.
Okay.
There is a reason that I'm doing this segment. Okay, so this is a segment about a plastic surgeon absolutely getting roasted by Troye Sivan because this plastic surgeon gave him unsolicited advice of what procedures he needs. Wow. Do you guys know this guy, Troye Sivan?
Am I supposed to? Because
I don't know.
I try not to say things.
I don't know who he is either. I do know
don't.
he was in one of the X-Men movies, so I know I've seen him because I do like the Marvel movies. So he was like the young Wolverine.
Okay.
The guy's, he's 30 years old now, started out at 18 being a singer, got some popularity, had a couple somewhat hits, moved over to acting. He's been in a lot of things, but nothing where he's like the main character that I know of. But, seems like a good dude. Now, this guy, this is why I really feel bad for him in this whole situation. This guy has admitted that he has body image issues. Okay, that's publicly known that this guy has said, I have issues with my body. And one of the reasons is because he has Marfan's disease, which is a connective tissue disorder, which makes people be exaggeratedly tall and thin. And there's different levels of it. He's got a mild form, but it does affect his appearance. And so, this guy's got body image issues. He's got Marfan's, a mild, obviously it's not a disfiguring thing, but it does affect your looks.
You could give me some of that if you'd like.
You want some of the tall thing?
Just tall.
Yeah, tall, right? Yeah.
Just need a little height.
Yeah. Hey, man, I'm right there with you. I always wished I was taller, but it's like, you know what? You got to play the cards you're dealt.
Anyway, sorry.
It is what it is, yeah. So along comes this ding-dong, and I'm going to call this guy ding-dong, because I don't like this guy. Because he may be a good surgeon, but I don't like what he does. This guy, Dr. Zayn, Z-A-Y-N, he's actually a London cosmetic surgeon, which means who knows if he's actually legitimate. Like, cosmetic surgeon is not a real term that at least we use in the United States, who has made a name for himself on social media by basically pulling up celebrities and saying, this is what I think these people need.
Ooh.
Yeah, right? I don't like that. That's not cool, man.
Yeah, I don't think that's cool.
I don't think it's cool to pull up somebody's picture.
And he doesn't know him.
No.
Personally, okay.
No.
Yeah, that's not cool.
So, all right, I'm gonna pull up this video. I want you guys to be the judge of the video. So roll that tape, Mackenzie.
Troye Sivan is looking slightly different these days. He does appear a bit more older looking. You could argue that he is experiencing twink death. Many of you have noticed the same thing, saying that he does appear different. He may go and get some procedures in the future, and you also notice that his new fashion item is rather unusual. When you look up before and afters, there is a big difference. Now, as an aesthetics doctor, the first thing that I am noticing is a lot more shadows, valleys, and folds, a lot more volume loss. So areas that I can notice this, especially, are the under eyes and the nasolabial fold. So when you look down here, this area down here, there is a lot of volume loss here, and under eyes as well, there is hollowing. So these areas are causing shadows. Compare that against here, so you can see nice smooth transition from this under eye into the cheek and the nasolabial fold. Whilst it is present, but it is subtle. It's not as prominent as it was right now. So if he came to me as an aesthetics doctor, what would I recommend? So his problem areas are the under eyes and the nasolabial fold. Therefore, starting with the under eyes, I would suggest skin boosters first, give him an improvement, and then consider some dermal filler. Dermal filler, I don't think about straight away, especially if the volume loss is mild because it carries certain complications. For the nasolabial fold, I would say a tiny bit of filler to essentially improve the appearance of that. Those are his two areas. Alongside that, topical skincare, optimizing his skincare to ensure that the quality of the skin is far better, and then we'll also think about some skin resurfacing treatments, either microneedling, a light chemical peel, or some light laser resurfacing to improve the overall quality and make his appearance more radiant and more youthful look. Essentially, we would retwinkify him.
He's gonna retwinkify him. I don't think, I was just watching it. I doubt that guy's a surgeon because he kept saying he was an aesthetic doctor, and they're very specific about, in England, I believe, like surgeons are always called surgeons, they're not called doctors. So he's probably like some Botox guy, I'm guessing. But
either way, when you have nothing nice to say, you don't say anything at all.
Yeah, right.
We've learned this a long time ago, people. That's what, so social media is my business, okay?
Right.
But this is what is wrong with social media, is there are so many people who just put out there things that were not asked for.
That's so true. That is so true.
He did not ask for that.
No.
No, if he went to the doctor and he said, tell me, then there you go.
Right. Yeah, I just don't.
We don't care.
I don't like that guy. Not
I don't
the
like that
actor.
guy.
I don't like that doctor, I'm going to give him a quote, doctor. I mean, it's just not cool
it's
to
icky.
do that. Yeah, it is. I mean, I honestly, I feel bad, like, sometimes talking about when, say, they say celebrity plastic surgery, and we're like, okay, this happened plastic surgery. I mean, I almost feel bad about that, but I do think there's, like, learning to be gained from it. But, like, soliciting someone's picture and saying this person should get this and this and this, like, that's different to me.
Yeah.
That's just like a different ballgame.
He's doing it for clicks.
Yeah.
That is the only reason he's doing that.
Yeah. So anyway,
that guy's not coming to you, FYI.
Well, Troye took offense to that guy's post.
I'm so excited.
And
can I have popcorn?
He made his own post that started out with F this guy. And then he had all these things to say. And he went on and said, what good is money in modern medicine if not to fix all of the flaws this random effing plastic surgeon told me I have in an Instagram reel? And so obviously the court of public opinion fires up because, this goofball doctor's got some followers too. And the doctor got roasted. Yeah, he got roasted. And
Good.
He should have. Yeah, he got
I'm actually going to go look him up after this.
I'll send you a link. He took down the post, and then he actually reached out to this guy to personally apologize.
Good. I hope he feels like
I mean, it is good that he
idiot.
did that, yes. But
Yeah.
it's like, come on, dude. Anyway. But I did have a take-home point about this, because the first thing that I thought when I saw this guy, the doctor doing this, is I don't like that. I don't like someone in a potential position of power telling someone what they need, right? Because I feel like if someone came into my office and I said, hey, I really think that you need to do this surgery because of X, Y, and Z. Like, I could get up in their head that they really need to have to do that surgery.
Yeah.
And to me, number one, it's just gross.
Yeah.
To say someone needs to have surgery. But number two, I just feel like it's a conflict of interest. You know what I'm saying? I'm using my power to persuade someone to spend money.
Yeah.
And I don't like that. And I think that people should be very wary of the fact that if they go into get an aesthetic or plastic surgery consult, that if that person's telling them what they need instead of like what my options
unless you
are.
ask.
Right. If you ask, it's a different story.
Okay, because I go in and I'm like, hey, what do you think? Because I trust, what do you think?
Right.
Okay.
Yeah, if you ask, it's a different story. But like unsolicited, you need to have these procedures. I don't like that. To me, that's a red flag. And people will come into my office and ask me, what do you think I need? And my first thing I say is, I don't think you need anything. Like, need is a very strong word. If you ask me what areas can you improve, like you'd get a good result, I'm happy to tell you, but I'm not going to tell you what you need. And I just flat out tell. And I think people like that. And they're like, thank you for saying that.
Yeah.
So, all right, let me recap this one real quick, and then we are going to have to run. So there is I'm not even going to say he's a plastic surgeon. There's a doctor over in London that I don't like, Dr. Zayn, who's made a name for himself, basically pulling up pictures of celebrities and telling them what plastic surgery they need. Well, he did that to Troye Sivan of Marvel and X-Men fame, and Troye didn't like that, and he absolutely roasted him on social media, and this guy had to take down the post and apologize. Good job, Troye. Man, I like to see that. And I do not like when doctors or surgeons tell people what procedures they need. I think it's almost an abuse of power where you're telling someone they need to have this and then you're getting money for that. I do not do it. I refuse to do it. If you come in and you ask me about something, I'm happy to tell you what your options are. But I do not like when doctors tell people what surgeries they need to or should have. I think it's a red flag, so be aware if you're out there getting a consult somewhere. So, okay, number 2 in the books.
Bye.
Awesome. All right, Mackenzie, thanks for filling in.
Yay.
You're a rock
No problem.
star.
This was a lot of fun.
You can fill in anytime.
Thanks for having me.
All right. Thank you guys so much for tuning in. I really do appreciate it. Please hit that like and subscribe button and leave us a comment. And we will see you next week on the next episode of Nip Talk. Bye.